Okay, so hello everybody. Again, we'll be talking about pathological demand avoidance a bit per session today. So it is basically a bit of increasing awareness. Pathological demand avoidance is a profile that describes those whose main characteristic is to avoid day-to-day demand and expectation to an extreme extent. So basically, we will get to this about the history. That is a term first used by Professor Elizabeth Newson in 1980s to describe the profile of a group of children she had seen in assessment. And that was first appeared in a journal article in 2003. And Elizabeth Newson described PDA as sitting under the umbrella of pervasive developmental disorder. Diagnostic criteria for autism are continually reviewed and developed. Currently, categories of pervasive developmental disorder now being replaced by autistic spectrum disorder. Pathological demand avoidance is increasingly but not universally accepted as profile that is seen in some autistic people. The term extreme demand avoidance emerged as an alternative term to the pathological demand avoidance, as some feel extreme is more acceptable term than pathological. Now, what is PDA? The existence of PDA as a diagnostic term and how to fit it within autistic spectrum is widely debated. With limited evidence-based research, and there is no conclusive or agreed actually regarding this definition of PDA. What is generally agreed upon is what is often referred to a PDA profile. Here, then just we'll discuss about it, that about this profile. People with PDA profile are driven to avoid everyday demand and expectation to an extreme extent. This demand avoidance is often accompanied by high level of anxiety. Although there is no prevalent study as yet, the demand avoidance profile is thought to be relatively uncommon. However, it is important to recognize and understand the distinct profile as it has implication for the way a person is best supported. Demand avoidance is not just seen in those with PDA profile, so would need to be seen with a number of other features. So basically, we have to see the features that we can see. Autism is dimensional, meaning individual profiles can vary considerably depending on the combination of a person's strength and difficulties across two dimension, how someone relate socially, and the need for sameness, often resulting in repetitive and rigid thoughts and behavior. People with a PDA profile can appear better social understanding and communication skill than some other autistic people and are often able to use these to their advantage. However, these apparent social abilities can often mask difficulty with processing and understanding communication and social situation. The distinctive features of the demand avoidant profile include resist and avoid the ordinary demand of life, uses social strategies as part of avoidance, for example, distracting, giving excuse, appear sociable but lack some understanding, experience excessive mood swing and impulsivity, appears comfortable in role play and pretend, and display obsessive behavior that often focus on other people. People with this profile can appear excessively controlling and dominating, especially when they are anxious. However, they can also be confident and engaging when they feel secure and in control. It is important to acknowledge that these people have hidden disabilities. People with PDA profile are likely to need a lot of support. The earlier the recognition, the sooner the appropriate support can be put in place. So that is all about today's, and we'll try to discuss further assessment management about it. Bye for today.